Hello everyone, welcome to Jessie's MedBio. In today's section, I am going to explain about the neonatal resuscitation. So, neonatal resuscitation means it is the emergency care which we are given to the newborn baby who does not breathe or cry properly at birth to help them to establish the breathing, circulation and normal body temperature. As I already told in previous class that a baby will cry immediately after the birth. If not, firstly we are giving the tactile stimulation. After the tactile stimulation also, if the baby is not breathing means we have to start with neonatal resuscitation. So, immediately after the birth we have to assess or we have to ask about three things. That is the baby is born at term, which means whether the baby is a term baby or if the baby is crying or breathing properly, and also we have to ask that does the baby is having good muscle tone. And if the answer to all these three questions is yes, means we can give the routine care to the baby, which means drying the baby and keeping the baby warm and providing the skin to skin contact and also encouraging the early breastfeeding. And if the answer to any of these questions is no, means we should start with the neonatal resuscitation. Then coming to the TABC of neonatal resuscitation, which means T means temperature to prevent the hypothermia, A means airway to open and clear the airway, B means breathing to start the breathing, C means circulation to maintain the blood circulation properly. So, now I am going to explain about the steps of neonatal resuscitation. For that, first we have to maintain the temperature, that is the T. So, for that we have to dry the baby immediately after the birth. We have to remove all the wet towels, and if needed we have to place the baby under the radiant warmer. Thus we can able to prevent the hypothermia and we can able to maintain the temperature level. So second one is we have to establish an open airway. So that we have to first position the baby properly. We have to place the baby on their back. Then the neck should be slightly extended. And we have to place a small towel under the shoulder area. After that we have to start the suctioning. For that first we have to suction the mouth, then the nose. It should take less than 20 seconds only. And if the meconium is thick and the baby is not vigorous, or intubation and suctioning may be needed, which means if the meconium is very thick and the baby is not vigorous, means at that time the intubation along with the suctioning is needed. Then third one is stimulate the breathing, which means if the baby is not breathing after the suctioning also, we have to start the tactile stimulation, which means we have to rub the back or flick the sole slowly. Like that stimulation we can give. We should only stimulate the baby one time or two times. If still the baby is not breathing, means we have to start the positive pressure ventilation or PPV. So what all are the indications for positive pressure ventilation? Means apnea, which means the baby is not breathing. Then gasping, which means the baby's heart rate is below 100. So the procedure is first we have to place the mask over the nose and mouth of the baby, and we have to ensure that the chest is rising with each breath, and we have to ventilate at 40 to 60 breaths per minute, and every 30 seconds we have to reassess the heart rate. And if the heart rate is above 100 per minute, means we have to continue the routine care and observe by stopping the PPV. Then if the heart rate is between 60 to 99, means we have to continue the PPV. And if the heart rate is below 60, means we have to start the chest compression along with the PPV. So next one is the chest compression. What all are the indication? Means the heart rate is below the 60 beats per minute after 30 seconds of effective PPV. So the technique means we have to use the two thumb technique. So we have to compress the lower 1/3 of the sternum of the baby with our two thumb, and the depth should be 1/3 of the chest diameter. The compression ratio will be 3 compression is to 1 ventilation. While we are giving 3 compression, after the 3 compression we should give 1 ventilation. The rate should be 90 compression plus 30 breath. So 120 events per minute. Like this we are giving the chest compression. Even after the chest compression also, if the baby is not improving properly, means we have to start with the medications. So if the heart rate is below 60, after the ventilation and the chest compression, means we have to give the medications. To increase the heart rate, we can give epinephrine, and if the blood volume loss is there, we can treat it by giving normal saline. And if the baby is having severe metabolic acidosis, means we can give sodium bicarbonate. And then naloxone. It is very rarely using today, and also in very some kind of selective situations only these medications are using. That is about the neonatal resuscitation.